Welcome everyone to today's webinar, Streamlining Pre-Registration, Lessons from Augusta Health's AI-powered automation journey. On behalf of Becker's Healthcare, welcome and thank you for joining us. Before we begin, I'll walk through just a few quick housekeeping instructions. If you have any questions throughout today's webinar, you can type those into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. And if at any time you have trouble with the audio or video, please try refreshing your browser. You can also submit any technical questions into the Q&A box, and we have a team on to help. With that, I am thrilled to introduce today's speakers. We are joined by Carrie King, Core Delivery Lead at Notable, and Katie Adams, Administrative Director of Revenue Cycle at Augusta Health. Carrie is a health IT implementation expert with over 15 years of experience in steering organizations through the implementation process, with a strong emphasis on operational efficiency and measurable outcomes. At Notable, she oversees implementations for growth customers, ensuring that solutions effectively meet their operational objectives. Katie is a revenue cycle leader known for her proactive approach to defining and achieving strategic organizational objectives. At Augusta Health, she draws on over 20 years of experience to guide the direction of revenue cycle operations for both the hospital and its employed medical group. Additionally, she oversees end-to-end revenue cycle functions within a multi-specialty health system. Carrie and Katie, thank you so much for joining us today. I'll now turn the floor over to you.
All right, thank you so much. Before getting into today's conversation, I'd like to provide a high-level overview of who Notable is. So Notable is an AI platform for healthcare operations. Customers use our AI to build a personalized digital front door, manage quality and risk, and drive revenue enhancement. So every workflow in healthcare is full of manual burden. Traditionally, the only path forward has been to hire more people. When you need to process more referrals and call patients to schedule appointments, you hire more people. When you need to complete prior auth paperwork, you hire more people. And when you try to stand up an at-risk value-based care contract, you hire more people to do the chart reviews and outreach. So despite digitization, over the past 30 years, while there are 50% more physicians in the United States, administrative labor has grown by 3,000%. But healthcare is too expensive, and the path has become unsustainable. Healthcare can no longer afford to keep hiring more people to do every additional manual task, nor can it even find people to fill those roles. Notable exists to change this. We exist to help you leverage AI and automation to make your staff more productive, to process more referrals without needing more staff, to process more auths without needing more staff, and to automate chart review and outreach without needing more staff. In doing so, we not only improve our labor costs, we help you improve outcomes like quality and experience for both patients and staff, and provide relief for your overburdened care teams. Starting 20 years ago, the industry began digitization efforts with the EHR, and now we see the industry starting to adopt automation to unlock productivity. Going forward, operators will need to enable and monitor a digital workforce that bends traditional staffing ratios to improve productivity and quality of care outcomes. With that, I'd like to turn it over to Katie Adams to give an overview of Augusta Health and the operational drivers behind the work that we did together.
Perfect. Thank you, Carrie. So I am delighted to join you today from Augusta Health. We are one of very few independent community hospitals left in the state and really in the country. Carrie, if you could advance to the next slide, please. Augusta Health's mission is to strengthen the health and well-being of all people in our communities. We did a mission brand refresh very recently, adding the word all and pluralizing the word community, and we did that intentionally. We really have a focus and a mission to make sure that everyone in our community is getting the service that they need, regardless of their socioeconomic statuses and their ability to pay or seek healthcare or actually access healthcare within our community. One of the pictures on this slide is a group of individuals who had the pleasure of receiving a CMS Health Equity Award. We're one of 2 hospitals in the nation to receive that award. Also this year, we received a American Hospital Association Health Equity Award, the Carolyn Boone Award, awarded to only one of 3 hospitals in the nation as well. I think that is going to be important as we talk about the solution that we were able to employ with Notable, and making sure that we are delivering an experience that is customized and tailored to all of our populations of patients. We are a 255-bed single hospital health system, but we do have 225 employed providers. We have about 2,300, 2,400 employees, and our main EHR is MEDITECH. We do have Athena for our practice management system. So sometimes integrating those 2 solutions is a little bit of a challenge, and Notable was able to help us with some of that. So yeah, happy to be here. Thanks.
Thanks, Katie. So I'd like to talk a little bit about why you were looking to transform the pre-registration experience. I think we've got a few slides that talk through the process here. So turn it back over to you to walk us through that.
Sure. Yeah. Before we get started on the actual process, we had in January of 2023, January of last year, we were expanding our footprint. And when I say our footprint, I mean our physical footprint. We built a state-of-the-art outpatient pavilion with services for breast care, outpatient surgery, and also radiology. And when we opened that state-of-the-art facility, we really wanted to make sure that the registration process, the scheduling process, the pre-registration process brought with it that same refreshed and renewed feel for patients. The other thing that we were tasked with is opening the center FTE neutral. So we were expanding our physical footprint, but we were not, at least immediately, allowed to increase our staffing, which meant the same amount of staff would be doing the pre-registration, the scheduling, and even the registration. And you can imagine now doubling, if you will, the registration points of entry, how that had posed a challenge for us. So Augusta Health went through an extensive evaluation on a tech partner that would be able to come in to help us with a digital platform for patients to be able to digitally register, pre-register for their appointments. We evaluated, I believe, 8 to 10 different vendors and talked to Notable at length about what we were trying to achieve, and ended up selecting and partnering with Notable based on their ability to, first of all, have a quick implementation, but also be able to customize an experience the way we wanted it. Many solutions out there have a solution but it's an out-of-the-box solution. It's a solution that you integrate with based on their predefined criteria. And we were really looking for a partner that could help us build something that was Augusta Health and Augusta Health customized workflow. So prior to our implementation of Notable, I don't think this is unheard of in our industry. Frankly, Augusta Health has prided ourselves on giving one-to-one kind of that person-to-person experience with patients. So this is kind of what that process looks like. We would end up getting a report or some type of tickler about 14 days before the patient's appointment. And then our staff would end up calling that patient to do the pre-registration. So you can imagine, next click, Carrie. You can imagine that calls are made during the day. We don't have 24/7 pre-registration and scheduling staff. There were times when patients didn't answer, and of course, most people are working during the day. So that posed a challenge for us to be able to even contact or connect with those patients. From there, if we were lucky enough to connect with the patient, we would collect patient information, demographic information, insurance, signs and symptoms, the MRI screening questionnaire, all of that would be done over the phone. And, you know, that could be over the matter of maybe 10 to 15 minutes or up to 47 to 50 minutes. I actually experienced a phone call because sometimes our community likes to talk. So we found ourselves having some non-patient registration related conversation, which we love, but it slows down the efficiency of the staff. If the calls went unanswered, staff would leave voicemails and request a call back, of course. From there, you know, if we didn't get a call back from a patient, you can imagine we then were left with, do we continue with leaving the appointment on the books? Should we reschedule? Should we cancel that appointment? And one of the objectives we were trying to achieve while we were implementing this solution was what Notable calls this stickiness, where we didn't lose patients to cancellations and no-shows. So that was one of the objectives we were looking to achieve. Once we got all of the information in from a scheduling standpoint, the patient would come to do the check-in and the registration, and we still were having the patient come in, physically sit down in front of the computer. Our registration staff was collecting pretty much that same information over again, scanning insurance cards, having paper consents, printed and filled out and signed, scanned back in, and that process took 10 to 15 minutes in and of itself. Not to mention there is some errors that are prone to happen when you have manual data entry and when you have a human interacting with that. So this is just, again, what we came into this experience thinking this is a very concierge type service, personal service. What we quickly found out was a lot of our patients like to do this on their own. So we'll talk about that in a second. So as you can imagine, the previous solution, and there are still patients who want that personal touch, and we still offer. We did not go 100% digital. We have a process now that if patients do not engage with the Notable pre-registration process, we still reach out to them. We know that there are patient populations who have not completely embraced the digital engagement. So we still do offer that manual solution. When we started to go into streamlining our pre-registration, though, we really, again, wanted to define what our goals were going to be. We wanted a user-friendly interface. We told ourselves that the older population of patients wouldn't embrace this technology, and you're going to see in just a second how that became untrue very quickly. We searched for solutions. I said that we vetted, it was 8 to 10 different solutions. And when I say we vetted them pretty deeply. We needed a partner that could help build a custom solution for us. It was important to have a partner that has worked with MEDITECH before. We are not an Epic shop, so many times when we're looking for tech solutions, the first question is, what EMR are you on? And there are a lot of individual companies that do not really interact or interface with MEDITECH. With Notable's technology, though, they're able to use that bot technology and enter in information into MEDITECH, and we'll probably talk about that a little bit more too. It was important for us to go live quickly. We actually, before we opened the pavilion in January of 2023, as I said, but we wanted to test the process in advance of the pavilion launch. Our women's imaging and breast care service actually moved holistically from our main inpatient tower over to the outpatient pavilion. And so that provided us a great spot for us to implement the solution, test it, frankly, find out where we were going to have failures or opportunities very quickly. The great part about Notable is they could make changes on the fly. So if we were outreaching in the wrong intervals, maybe 3 days before the appointment was not soon enough, we could make changes, implement those changes within a matter of hours, to be honest with you. If there was some terminology through the patient registration process that didn't quite make sense to a patient, made sense to us, but it wasn't customer friendly, we were able to make changes to that very quickly as well. And we receive feedback from our patients constantly, and made those iterative changes throughout the implementation process. When we finally launched in the pavilion, we opened it up to all service lines that are there. Like I said, imaging, breast care, and outpatient surgery. What that also meant, though, is we could have different criteria and different protocols for each one of those service lines. Maybe 3 days in advance for a screening mammography was enough time. However, 3 days in advance of an outpatient surgery, I think most of us would get a little itchy if the first outreach to a patient was only 3 days before a surgery was to happen. So very, like I said, very detailed and customized that we were able to develop the solution.
All right, so let's talk a little bit about what that experience looks like now. Katie, can you walk us through what the patients see when we complete this outreach?
Yes, for sure. So we have a series of text messages and also emails. We want to make sure that the patient feels comfortable interacting with the tool in whatever form they want. So for me personally, I am a patient of our breast center and I prefer text message. So depending on the interval that we have set, and again, we can set that 2 weeks before the appointment, 3 days before the appointment, we can have multiple outreaches to the patient via text messages or emails. The patient will get an email or text message, or maybe both, just letting them know that they have an upcoming visit. And then there is a link that takes them into what we call the experience, which is the pre-registration process. As you can see, it's branded as Augusta Health. We welcome them for their visit, and we ask them to fill out the registration. It was important for us to capture the relationship to the patient. Notable is able to e-sign consents for us, and of course, we passed that through our forms committee and our legal team to make sure that we had a stamp on our consent forms that allowed for it to be electronic. The patient instructions, so I'll tell you, going into this experience, I did not understand the power. One of the things that was a good surprise for me is the power of Notable's customization. I've mentioned that 1,000 times, but the patient instructions that can get down to the appointment type level for those patients. So you may have a patient, and I don't have a strong clinical background, so I might fumble on this a little bit, but you may have a patient coming in for an MRI scan that requires certain medication instructions, or for them to be fasting, or for them to take PrEP for contrast. You wouldn't want that same patient instruction being delivered to someone who's having, say, a screening mammography, where really for patient instructions there, it's don't put on deodorant, right? So we were able to generate very specific appointment, specific instructions for the patients. And it flows very naturally. The registration screen pops up, they're entering their demographic information. By the way, they can take pictures of their driver's license and their insurance ID cards. Once the patient has gone through the experience once, it remembers them. So we don't have to capture those driver's license and insurance cards a second time. It will present what it has on file and just ask the patient if this is still the appropriate insurance. There is some other power within the tool with optical character recognition, where it can lift information from an insurance card and actually auto-select the insurance mnemonic, is what it's called in MEDITECH, but the insurance that's most appropriate for that visit within our system. And then forms and documents are simply just the consent forms that the patient would sign with their finger, or a stylist or whatever they might have. It was really important for us to going into this that we did not have a solution that required a login and password. If you are using digital solutions today, whether that's shopping on Amazon or whatever the situation might be, having to maintain a username and a password. I have a whole list of those for myself, and there's probably 50 of them. I don't always remember what I have in every single solution or technology that I'm using. So it was really important for us to work with Notable to determine a couple different factors of authentication that you're not going to forget. So through the patient's date of birth, because Notable is taking feeds from our MEDITECH system on upcoming appointments, Notable has already consumed a lot of this information, and we really just need the patient to validate that we've gotten the right patient through the text message. So the patient goes through and enters their name, date of birth, and a couple other very short, easy authentication methods, and then it brings them into the experience. Let's see. And then it was also very important for us to capture how do patients like this? Are they loving the experience? Are they hating the experience? And have a spot for them to tell us what they liked or didn't like about it. Early on, and still today, but very early on, every day I was reading these comments. And you're going to see an example of a couple of them in just a minute. But with this, the customer experience questionnaire, and already having the patient demographics in the background, we're able to extrapolate and segregate that information as much as we want to see which patient populations are loving the experience the most, which ones are maybe challenged with it, and we had some surprises there. So far, we have 4 hospital-based service lines live with Notable. We've sent out about 56,000 individual pre-registration links. We've had 17,000 annualized digital intakes completed. And then it's saved, like I said, so it's saved about 7 minutes per digital intake. That's more on the registration side. So again, as a patient who's coming in for a routine visit, I no longer have to go sit in my booth, pull out my insurance cards, pull out my IDs, go through the whole registration process, confirm all of my information. It's there. When I go in after completing the Notable experience, they validate who I am, put an armband on me, thank me for coming, and then I have a seat. It's literally about 30 seconds to check in. So that's been a huge time savings for our team members. It's been very important for us to understand how they're liking the solution and how that has helped them with their workload too. And then that customer service question at the end, we've gotten about a 94% patient satisfaction rate. Of course, I'd love to be close to 98 or 99, but 94 is pretty good.
One thing that's not on the slide that I would call out is another metric that we watch closely, and that's the conversion percentage. So the number of patients who end up getting all the way through the experience. And that's always right at 60%. Sometimes it bumps up a little bit above that, but hugely impactful when you have that portion of your population completing this ahead of time.
That was a metric that we were specifically aiming for too, was that 60%. When we got above the 60% threshold, we all really celebrated. And then here you can see some of the patient individual feedback. I think what I would draw your attention to is the age of the patients. 65 to 74-year-olds, 75 to 84-year-olds. I won't read all of these to you, but you can see that they're really appreciating the experience. They're able to engage with it. They feel like it's easy. Again, when we first went down this road, we had team members, some of my team members, transparently, even me, who said, is my mom going to actually do this? Is my grandmother actually going to do this? They're not going to do this. They're not going to know what to do. My 88-year-old grandmother is on Facebook. So if she can be on Facebook and interact with the family through Facebook, I think she can probably do this digital intake. So That was one of the biggest surprises for us is the age population that is actually utilizing the technology. They're embracing it. I think we like to think that they're going to shy away from it, but they're not. And I believe, if I'm not mistaken, that this age population, the 65 to 74 and the 75 to 84, are also achieving that 60% conversion rate metric.
Yeah, it's our top performing demographic, actually.
Such a surprise.
All right, so I want to switch gears here and just move to our fireside chat portion of the conversation. Katie, thank you so much for walking us through the overall implementation and the goals of the project. I wanted to dig into a few questions here. So the first one, you gave us a lot of great background information on who Augusta Health is. One of the things I think is really unique about Augusta, first of all, it sits in like the most beautiful place in the world, especially this time of year. And I know I'm a little biased as a Virginian as well, but it is at a crossroads. There's a lot of neighboring health systems nearby. And I'm just curious, like how does that shape the identity of the organization and how you think about taking on patient engagement strategies?
Yeah, that's a good question. You know, we have competition. There is the infamous Afton Mountain, which sometimes we believe is a physical and geographic barrier for patients wanting to travel for their health care. But the truth of the matter is they will do that. We've had a number of different patient studies who say we'll travel for 30 minutes to seek care at a hospital. What we want is the relationship. What we want is to feel like we matter. We don't want to feel like a number. We want to feel like you are expecting me, and this experience that you have delivered to me, whether that is seeing the provider, digital outreaches, registration, is curated specifically for me. So we've done a number of different studies and also have built a number of different solutions to make sure that patients feel as if the experience is curated for them. The other thing we're really leaning into is innovation and AI and technology and machine learning and all of the acronyms that are the buzzwords these days. I was lucky enough to be able to speak with a colleague of mine who I respect so much a couple months ago at an HFMA meeting. And the question was asked, what is your organization doing about AI and technology? And some of the healthcare systems, I think, are a little scared of it. They don't know what to do with it. They don't know the capabilities. Augusta Health has kind of taken a different approach when it comes to that. We're leaning in. We know that if we do not, as an industry, figure out how to digitalize and innovate in the healthcare space, somebody will figure it out for us. So that's the other thing that's been really important for us. So we have an awareness, leadership awareness, and also an allowance, if you will, to implement different technologies to see if they work. As an example, we're doing some virtual nursing and things like that too. So hopefully that answered your question.
Absolutely. I think one of the things that's very interesting about the work that you've done here is that we've created a very personalized experience, but making it asynchronous. And it's not that human-to-human conversation. Can you tell me a little bit more about how you thought about that and like why that's such an important driver for Augusta?
Yeah. Again, I think it's a matter of curating an experience for a patient that feels like it was meant for them. So I think one of the biggest examples I can give for that is our Medicare secondary payer questionnaire, which is, you know, our registration staff just love it because it has to be asked at every visit. And we really, really struggled with implementing or thinking that we could implement the Medicare secondary payer questionnaire into the digital registration platform. And frankly, when we first launched, we did not have that. So we told ourselves this is too complex, we can't figure this out, we're still going to have to manually outreach to these Medicare patients and or catch them at time of registration to have them fill out that Medicare secondary questionnaire. I think the reason why we told ourselves that, though, was trying to input and implement the Medicare secondary payer questionnaire in the same format and version as we would ask it in MEDITECH was very difficult, cumbersome, and hard to build. So I cannot tell you how many hours we spent with Notable trying to reword the questions, reorder the questions, have some conditional questions, right? So there's, if you answer the question one way, there's no need to ask the rest of the 10, 12 questions, then just let's not do that. So I think we were putting limitations on ourselves that Notable did not have, right? Notable knew that they could implement the Medicare screening questionnaire and change up the verbiage to make sure that the Medicare patients understood the questionnaire, gather that information and still put it back into MEDITECH in the format it needed to be in, answer all of the questions with high integrity. But from the patient's experience, it looks very different than the questionnaire that is actually in our registration pathway in MEDITECH.
I think that's such a great example, especially when you think about just how out of left field some of those questions feel, like a non sequitur within your registration experience. I think the opportunity to be very deliberate and consistent about that through a digital experience unlocks a lot of possibility there. I think that also like segues into another question that I have. Obviously, like, the patient experience is paramount here. Making sure they see the value proposition and engaging in this, and that they feel known, where we're pulling information from the EHR, asking them to validate instead of asking them to refill out forms over and over again. Those are critical in our success, but it's also critical to make sure that staff feel like some of their workload is taken off their plate as well. So like, what impact has this had on your team, and how are they thinking about automation now, going forward?
Yeah, it was a bit of a challenge to start with. So, you know, we have revenue cycle teams, the patient access registration, pre-registration teams being at the top of that list, who really care about delivering very good quality and integrity in the work that they do. So one of the things that we were challenged with a little bit at the beginning the most is coming back and double checking on Notable, which, to be frank, in the beginning, I wanted that, right? I needed to make sure that these magic robots that were doing all the work for me were doing it the way that my team would, and we weren't leaving anything out. And so having 100% review at the very beginning was really important to me, and good, because we caught some things that that we could fix very quickly. Once we got to a certain comfort level, though, talking to the teams and saying, okay, this is just, this robot that's using this technology is just like another team member. So, you know, the quality of the work that's happening there is the same quality of work that would be happening if you were doing it yourself. So it was a little bit of a challenge for us to lean into that at the beginning. Again, the organizational theme now, though, is let's look for opportunities to do this. Let's look for opportunities to make our processes more efficient, and they're really embracing that now. The registration teams love it, again, because there's no more printing consents and scanning it in, and so it has really improved their process a lot.
Wonderful. So I think you mentioned earlier about how the engagement and satisfaction among patients who are 65 and older was kind of a surprise as we went through the implementation, just to see how strongly they responded to it, and valued that experience. Has there been any feedback from your staff that surprised you, or anything else from patients that's been surprising, like on this side of the project?
I don't think so. I think, you know, I have had some, this is a small community, right? So we know each other, and we are all patients of our hospital. So Typically our biggest critic is our team members as a patient. So I have had nothing but positive feedback from team members as patients. And I think that is the highest form of
Absolutely.
approve, if you will, that our team members would give us that. Absent that is no feedback, which is always good too. Most of our team members have my number on speed dial. So if anything does not go the way that they expect it to, and by the way, this is all because the majority of our team members have a deep-rooted connection to our mission and our community. And if something goes haywire with their experience, they want to share that so that we can make sure, not for anything for them, but make sure that the next patient does not have that same experience. So, so nothing but positive feedback from team members and patients.
Glad to hear that. So I think we've talked about this in a couple different places throughout the presentation, but I want to circle them all together. As far as the efficiencies that you were able to achieve, it sounds like, starting off with the project, there were two goals here, to provide that known concierge experience that mimics the in-person experience patients would receive once they came to the new pavilion, but also keep headcount static during that process. Have there been any efficiencies that you've gained that were maybe a surprise going into it, maybe not the focus, but a happy occurrence throughout the project?
Yeah, I mean, we didn't really go into it trying to achieve many staff efficiencies, but what I will say is our radiology service line volumes have grown astronomically over the last couple of years, and they're projected to grow even more. So we haven't quite yet quantified the pre-registration staff savings, but again, what we have been able to do is grow in volumes without having to grow our staff. So that's been a nice efficiency for my team.
Wonderful. So changing gears a little bit here, from the tactical to more of the vision. How did you explain your vision and the goals, both to staff and to the stakeholders within the organization as well? I think this is one of my favorite parts about our partnership, is how you're able to paint that picture. So I'd love for you to tell our listeners about how you went about that.
Yeah, so it was multifaceted. I think one of the biggest key stakeholders were the actual pre-registration and registration teams. And it was just an explanation that, again, the organization is leaning into innovation. We want to be able to bring some of this digital experience to the patients, and ask for them to support. I mean, we have very supportive team members. We have support of our executive team and our executive leadership team, and that permeates down. So that was the biggest key stakeholder group. From there, it was presenting. I had a number of presentations to our senior team, showing them the experience, showing them the improvement that we could make in the process. So it honestly was a pretty easy sell, right? There wasn't much at all that was going to deter us from doing this.
I know you mentioned that there was definitely a long process to determine the best course of action here after you set the vision, worked with several different vendors to determine who could best execute on your vision. Did you try using your EHR first for any of this?
We did not. To my knowledge, MEDITECH does not offer this in our current MEDITECH client server platform. So we did not explore anything within our EHR, just it didn't exist.
All right, and one last question here. What's next for Augusta Health?
Oh gosh, big things. So we are just constantly on our journey to make sure that our community is taken care of in whatever way, shape, or form that means. So we are always looking at health equity within our community. We're looking at patient populations that are being underserved. I think we've had some tremendous success there. For the revenue cycle, what's next for the revenue cycle? More fun in bringing innovation to our process. I'm really, really looking forward to that. Getting some streamlining, yeah, just exploring what's out there for digital engagement and, you know, continuing to carry out our mission the best way we know how.
Wonderful, Katie. Thank you so much for making time to speak with us today. I think it's been a wonderful conversation, and I really appreciate all of your insight.
Thank you, Carrie.
Wonderful. Well, thanks, Carrie and Katie, so much for your time and insights today. I'd also like to thank Notable for sponsoring today's content. To our audience, thanks so much for joining us. Feel free to fill out the post-webinar survey on your council, and we hope to see you soon.